So, we beat ourselves up a little bit in this industry, but the reality is, particularly in this marketplace, I'm seeing some really, really neat things happening. And we have a ways to go, but we're on a really, really good track.
So actually, an iPhone with superior performance costs less than it did when it first came out. This is my goal, and the goal of other entrepreneurs for healthcare, is to make healthcare work like that, like the iPhone.
And there are a lot of people who say competition will take care of it. My view is competition, frankly, has caused a lot of it. And I won't go too far into that, but it needs to be addressed.
There's one thing that drives down prices, one and only one thing, and that is market forces. Market forces are the only thing that I know of that drives down prices.
Those counterparts from other part of the country say, doesn't it bother you that you have that huge consolidation, you have those huge integrated delivery systems? My answer is, at one point in time, several years ago, it was a cause for concern, because I believe that when it started, it was largely about leverage, if you will. It was largely about greater market power. Today I see that size, that expertise, that ability really being used in a very, very positive way, and really focusing on that word accountable as much as anything else. So I think that what's going on, that the consolidation in many ways can be a positive thing.
If Blue Cross had the luxury of paying the claims prices that it had in 2007, in 2011, they would have spent $600 million less on claims. $600 million in total. If 2007 prices were the same as 2011 prices. You extrapolate that to the other payers, and by payers now I mean health insurance companies, in the market, you're at least looking at $1 billion. $1 billion premium in 2011 compared to 2007.
My point here was simply, when all is said and done, I think what consumers, what purchasers, what regulators, what legislators, what everybody has really been asking us to do is to quit talking about ourselves as a system, but refusing to behave as a system, and to get to the point where we really start to look like we are, in fact, a system.
And let's define solving healthcare by prices being lowered across the entire healthcare spectrum by at least 50%. At least 50% within a year of implementation of said solution.
And many, many good things in this marketplace, or in any marketplace, fail to achieve their potential because someone backs away and decides they want to compete on that thing as opposed to collaborate on that thing. So in almost every discussion that I'm in nowadays, it's the first thing I want to talk about. Let's just right up front, either we're all into this and it's a collaborative effort, or let's not even talk about it, because at some point in time, if someone in the room is going to cut and run, or decide they want to use it for competitive advantage, as opposed to helping us all sort of raise the overall level, if you will, then it's not even worth the effort from the start.
One of the main indicators that there is competition occurring in an industry is if the prices are going down. If prices are going down, you know there's competition. So the corollary of that must be that since prices are going up in the healthcare industry, there is actually no competition, by definition. Competition leads to price reduction.